imeisha. Na nikiwaambia dunia imeisha, wanasema Mackenzie mwendo wazimu. Sasa wazimu inafanya kazi. Mwati wa microchip nyote kwa ujinga wenu. Vikadi vyatolewa la mahali, kaunti zote za Kenya. Obama Healthcare. Alafu wameibadilisha jina ati wanaita Universal Healthcare. Universal Healthcare. Kwa nini sio Village Healthcare?
Universal health coverage. What is it? Let's start with the definition. This is basically what it means for everyone who will be under the program. It means you are covered for basic healthcare services without the risk of out-of-pocket expenses for you. This is entirely, well, essentially what it should be. All right, so let's take a look at this one next. Exactly what services will be offered under this. The President highlighted this earlier today. Community health services, which is very big on preventive health care, basic primary health care services, outpatient consultation, diagnostic investigations, and inpatient admissions. What it does not cover is cosmetic surgery, some cancers, and chemotherapy services. They say that with time, these will be introduced at that point. So what do you need to do to get yourself on this program? I'm sure you have seen the public service announcements that have been running on various media houses. So first, you register. And then you provide them with all the information on you and your family. You are especially required to not hold anything back. And this is a very important step. You choose your primary healthcare facility. Now this coverage is county specific, and I will explain what that means in just a moment. So, which counties will be piloted? By now you know Isiolo, Kisumu, Nyeri, and Machakos. I want to talk a little bit about why these were chosen. They're representative of the country in a number of ways, specifically in disease burden. So let's talk about Kisumu, for example, which is where it was launched by the President today. Representative of malaria, TB, HIV, these are the communicable diseases. Nyeri was picked because of the non-communicable diseases. Isiolo, on the other hand, was one of picked because of its sparse population, to see how this would be rolled out in areas similar to Isiolo in terms of population, but also for its high maternal mortality rate. All right. Machakos was picked also for high road traffic accidents. That is something that is big in this country, and that they're trying to see how they can put that into the universal health coverage. So this is why they were chosen. So the next question you would ask is, what will the other 43 counties be doing? Because remember, this pilot program happens over 6 months, and in a year it'll hopefully move to the other 43 counties. They won't be sitting pretty throughout this period until it is launched countrywide throughout the countries. They will be improving their systems during this one-year period. What will they be doing? They'll be investing in things like infrastructure, ensuring they have adequate supplies, training workers, and of course hiring more health workers that are so critical for this coverage to work. Now this is something that has worked in a number of countries. Rwanda is one to note on the continent. The rest, Thailand, Japan, Korea, Philippines, Mexico, Singapore, and Canada. Now, let's talk a little bit about what this is, because many people think it's just about it being free. Well, the government has got to do a lot more in terms of ensuring that there is proper infrastructure in hospitals, that there's adequate water supply that is clean and healthy to be used. There's also electricity that must not just be affordable, but be of consistent supply. Generators are also required, because all of this would be useless if you went to a hospital for free, but on the operating table, power goes off. What happens? Generators needed. They also need those serious medical equipment, the diagnostic ones, that is now sort of the subject of controversy between the national and the county governments. Staffing for the equipment is extremely important. Also, staffing in general across all cadres of healthcare workers is something that will be key and a pivot for this to be successful. Here's another important one. KEMSA. This will be a big test for the Kenya Medical Supplies Agency to ensure that all of these supplies are there, so that it's not free and you go in and you can't find insulin.
Kwa nini sio county healthcare? Why universal? Alafu unarudi tena unaambiwa unapewa UPI, yani a unique personal identifier namba. Kijana mmoja Ukunda alituambia, waliambiwa na mwalimu ya kwamba hiyo namba ndiyo itakuwa kitambulisho chako, hiyo namba ndiyo itakuwa kila kitu chako, hiyo namba ndiyo utatafuta kazi nayo, hiyo namba ndiyo kila kitu mpaka kufa kwako. Sasa nikauliza, na hiyo unaita namba kweli? 6 character code unaita namba wewe? Hallelujah. Tuko pamoja? Na unasikia watu wanaojua kwenye vyombo vya habari wanasema, sasa mambo ni mazuri kabisa, nimepata kadi hii, sasa hata nikigonjeka mimi sawa kabisa, mimi nimelipiwa kabisa, mimi sina shida kabisa.